we will be providing an update on King County's coronavirus response. And you're going to hear from some of these leaders who are working diligently to provide accurate information to reach all of our communities. Coronavirus continues to be a very serious global issue. There is no sustained transmission in the United States at this time. But this is an evolving situation, and Dr. Jeff Duchin will be speaking to that more later. Our public health staff are doing an amazing job. With over 100 staff now involved in the coronavirus response. They're assessing people who, for the risk of contracting the disease. They're testing people who have recently traveled to China or who are exhibiting symptoms. They're monitoring anyone who has been in close contact with people who are under investigation and arranging for isolation or even quarantine where necessary. On top of all this, we're working with our community partners to disseminate credible information, to calm fears, to dispel myths. Many of our partners here today are working to support community members by answering questions and equipping employees with the information they need. This is a collective effort. Many of us are concerned about what people in our communities may be experiencing, including possible stigmatization or discrimination based on fear. We are not going to allow misinformation to take hold in our community. Stigma does not fight illness, but sharing accurate information, especially during a time of heightened concern, is one of the best things we can do. We are here today because we are united in our response. I'm pleased now to welcome to the lectern Patty Hayes, the Director of Public Health, Seattle and King County.
You being here today, and I know you have a busy schedule and are going to need to leave, but we all are so appreciative for your voice and support on this important issue. And I want to thank you all for being here and welcome you on behalf of our host, an amazing resource, the Asian Counseling and Referral Service. I'm happy that I'm standing here today with health, with community, and with our government leaders. As Dow said, we're going to be updating you later on all that we're doing to keep our communities safe, because now is the time to unite. And I want to reiterate something Dow already said, which is there are 0 people in King County who have tested positive for the novel coronavirus, and the risk to the general public here in our region and across the state is low. We in public health are working in 3 main areas. First, we're providing accurate guidance and information. Many of you have been working diligently to provide the best information to community members possible. We need all to know that we need to do more and we need to keep coordinated. That's why we need all of you to continue to provide accurate information. In our meeting down, we just finished with our wonderful community members downstairs. We agreed to set up weekly calls to brief our community on what is the latest accurate information. So we're seeking ways as government to look what we can do better and to keep better connected, to keep misinformation from being out and about. Secondly, public health, as you've heard, is monitoring potential cases of coronavirus and coordinating with the healthcare system so that we can detect any infections as quickly as possible and reduce the risk of spread. We have a strong public health system here that's able to respond to these type of situations, and we're happy to be present in community to reinforce that message. And very importantly, we need to address and prevent stigma. Your race and ethnicity does not put you at any additional risk or make you more likely to get sick. Let me say that again. Your race or ethnicity does not make you more at risk for this illness. We've heard of a number of harmful situations in the community, and we need to be forceful in saying no discrimination of any kind is going to be tolerated. As a white person, I am as likely to become exposed, maybe more so because I'm a nurse. I am more likely to become exposed if I had been in close contact as anyone, anywhere. It's universal. Showing fear or hostility towards someone based upon how they look is not only wrong and hurtful, it can harm our ability to keep everyone healthy. Public health needs to be able to work nimbly and with all. And the more we get into othering people or putting something in a category can inhibit my work in public health to make sure that everyone is safe and healthy. To be successful in containing coronavirus, we need everybody to feel welcome to seek medical care when they feel sick. As public health professionals and community experts, we know that protecting the health and safety is not only about safety from a virus. It's about creating communities where people can support each other and where we all have the basic needs met. We acknowledge that people's past history and their trauma can get exacerbated during times of stress like this. Instead of acting from places of fear or stigma, we want to, by having the correct information, put out that we can help understand that there's a low level of risk from the current coronavirus. Plus, we can understand the great harm we can make with stigma and discrimination towards certain people or communities. I encourage you, everyone in this room, to speak up if you hear, see, or read stigmatizing or harassing comments or misinformation. If you're hearing information that sounds scary, it may not be true, and you can check for accurate information at our King County website or Washington State's coronavirus website. We need to support our neighbors, to remember that we all belong here. When we do this, we're strengthening the health of our whole community and our whole overall health system. And one way we can do this is by showing up and connecting with our friends, families, and the amazing cultural spaces in our region that we have to offer. This weekend is a great opportunity to experience that at the Chinatown International District Lunar New Year celebration and their events. We are taking public health actions to protect and prevent a local outbreak and to be prepared if the epidemic comes to us. Our health system is stronger now because of our cooperation in our community. I've been deeply proud to see the many ways public health, community organizations, schools, and other governmental agencies have been working together. Connection is the antidote to fear and isolation. And clearly, we have a lot of that here today. Next, I'd like to introduce Teresita Batteola of the International Community Health Services.
Thank you so much, Patty, for the introduction. International Community Health Services is a community health center with many clinic sites around King County. So I'm here as a great partner to public health to tell you that public health is really doing a great job in letting us know about the latest information and keeping us informed in terms of what to expect. Because International Community Health Services serves many Asian Pacific Islanders and other immigrants and refugees, we were very quick to act. We immediately made sure that we had appropriate triage processes in place, both if people called over the phone or if they presented themselves in the clinic. We had clinical workflows where we were prepared to take them into either isolation rooms or negative pressure rooms. We have electronic health records where we can enter information and track people who might have symptoms, and we are communicating very, very closely with public health. And I will tell you that we have had zero patients who have been diagnosed with coronavirus. But we do hear widespread reports of those who look like they're Chinese or Asian experiencing stigma or racial profiling, that they would have coronavirus. This is a public health issue that we must all work together on, and rather than building on fears and building on suspicions, everybody should wash their hands. Act as if you're doing your best to prevent transmission of any kind of flu. The steps that we have taken as a clinic are steps that we have in place, that we put in place and act on every single flu season to make sure that everyone that we serve stays healthy. So to say that coronavirus is different at this time is not the case. Prevention is the best course of action. And like Patty, I would encourage everybody to continue to participate in activities in our communities, because we have had 0 reports in King County that we have coronavirus. Now I will turn this over to Lalita Upala, who is with the King County Commission for Refugees and Immigrants.
Hello everyone. I'm Lalita Upala, the chair of the King County Immigrant and Refugee Commission. And the first thing people can do about coronavirus and the fear that is surrounding it is to learn the history of stigma around the Chinese and broader Asian American community. As Patty mentioned, the stigmatization, bias, and racism that is occurring is not new, but is built on years of history and is harmful, painful, and has mental, physical, and economic impacts to our community. Going back to the 1800s, medical institutions, unions, and government entities promoted racist messages about how Chinese men and women were more likely to carry disease, barring them from entering the country, excommunicating them from the workforce, and further socially ostracizing them in the public. There are also important differences in cultural practices that many people may not be aware of. You may see people wearing masks and make assumptions about whether or not they have the coronavirus. What you should know is that in many Asian countries, wearing a mask is actually quite common. Many people are accustomed to wearing masks to avoid pollen and to, as a courtesy to others when they have the common cold and other cultural or social reasons. Seeing someone wearing a mask does not mean that they are ill. Additionally, it is flu season. So there are many other reasons besides coronavirus for people to be ill. There is no reason to assume everyone wearing a mask who is sick has the coronavirus. We are asking for your support, compassion, and active intervention if you see or hear stigmatizing words or actions. We also encourage you to come celebrate with us as a community around the events around the Lunar New Year. Get involved and build relationships with people across our communities. Thank you so much.
Good morning. I'm Jeff Duchin. I'm the Health Officer for Public Health Seattle and King County, and I'd like to thank our community partners for providing us this opportunity to share a lot of information with you today, both about coronavirus and about stigmatization. Let me start first by, again, providing a quick update about our public health response and the current status of the outbreak. Who is at risk for novel coronavirus infection? People who've traveled to China in the last 14 days and people who've been exposed to a known, confirmed case of coronavirus infection are at greatest risk. Risk does not depend on what a person looks like, their race, or their ethnicity. As has been mentioned, the risk of novel coronavirus infection in the U.S. is low. There's only been one case in Washington State, And coronavirus is not spreading anywhere in the community, locally or elsewhere in the U.S. But it's important to keep in mind that this is a rapidly changing outbreak and things will change over time. We expect more cases to be identified both internationally and in the U.S., including possibly locally before the outbreak ends. Currently, our efforts are focused on identifying and containing new cases of disease in order to prevent spread. This approach will provide additional time to learn more about the virus and, importantly, to prepare should a large outbreak occur. The CDC is preparing as if this will be the next pandemic, and I think we should all do the same. Now, in public health, we've been in close contact with our colleagues at CDC to be sure we have the most accurate information and guidance about this new infection. We're working closely with our community health providers and our hospitals to promptly identify any possible new cases for evaluation and testing if needed in order to minimize any risk of spread. And to date, Public Health Seattle and King County has assessed over 150 people for novel coronavirus exposure. We've tested approximately 10% of those. 15 persons met the criteria for testing. As you know, 13 of those have come back negative, and 2 people are still awaiting results, but we do not have a high index of suspicion that they will be infected. We're also currently monitoring close contacts of people who had contact with the novel coronavirus case that was reported in Snohomish County previously, and people who've returned from China in the past 14 days to be sure they've been adequately evaluated and can take steps from preventing the spread to others if symptoms should develop. It's not possible to predict the ultimate course or impact of this emerging outbreak. But we can do a lot to prevent the spread of this disease through tried and true public health interventions. Don't go to work or school if you're sick. This is the same advice we give people every influenza season. Cover your cough. Wash your hands. Don't touch your nose, face, mouth, or eyes unless you wash your hands first. We don't currently have an outbreak of novel coronavirus here in King County or in Washington State or in the U.S., and we certainly don't want to have an outbreak of fear, stigmatization, and discrimination either. It's important for us in the public health community and in the community at large to prevent both of these outbreaks. Earlier today, we had an opportunity to talk with our community partners and hear about the impact to individual sense of safety during outbreaks and some of the stories of discrimination, inaccurate information, and rumors. One example we heard about was the stigma that can occur when people wear masks in public. And although it's important to understand that public health doesn't currently recommend that people wear masks when they're in public, because 1, there's no coronavirus outbreak happening currently, and 2, they're not known to be effective in preventing infections when worn in public. Keep in mind that some people do wear masks for personal reasons. There are cultural reasons why people wear masks, and there are social and stylistic reasons why people from other cultures sometimes wear masks. So if we see our friends, our neighbors, or our community members wearing a mask, we shouldn't assume that they've been exposed to a coronavirus or any other virus. In fact, we shouldn't even assume that they're ill in any way. In closing, let me emphasize that the novel coronavirus is not unique or specific to any racial or ethnic group. If this virus comes to the U.S., it will be an equal opportunity employer. I currently appreciate the partnership that we have in King County to stand up and prevent stigma each and every day during disease outbreaks, and we're deeply committed to work each day with our communities to ensure that they remain as safe and healthy as possible. And with that, I'll turn over the podium to my colleague, Sharon, for moderating a Q&A session.
Thanks so much. Thanks again for being here. So I first want to open questions to anybody from Chinese-speaking media. We have Mandarin interpretation. So if there are any questions first, I'd like to take a couple there.
所以我是在这里做中文口译，所以如果你们中文媒体有什么问题的话，可以提问，我可以帮你们做翻译。
So we'll go ahead and take a few questions for anybody on the panel. Yeah?
I think she had a question.
Oh, please.
Hi, my name is Coco, and we are from Asian American Television.